my name is Kacy Glascock. I'm a PA here at Kelly Family Clinic. And since we are in the midst of flu season, I wanted to go ahead and talk to you a little bit about the differences between a common cold and influenza. The cold typically starts as a sore throat, and within 2 to 3 days you start to get some congestion, some runny nose, some cough. You might have a little bit of body aches or a low-grade fever, but with the flu it typically comes on with a sudden onset, cough, body aches, muscle pains, bad headache, and a lot of times a fever up to 102, definitely above 100 a lot of times, and that's rare with the flu. The fatigue with the cold is less severe. With the flu, you can have fatigue lasting for several weeks, and the duration of the flu typically 3 to 7 days. After about 7 days, you should already start to feel better, whereas the flu, it might last a little bit longer as well. There is an immunization for the flu. We do not have immunizations for the cold, so I do recommend getting your vaccine. And also with the cold, it doesn't require a prescription. We typically do over-the-counter supportive care, and that usually helps to resolve the cold pretty quick. Whereas the flu, if we catch it early, we do have antiviral medicine. Those include Influenza, which is a new one, and Tamiflu, which we typically have heard about before. It doesn't make the flu stop in its tracks, but sometimes it can reduce the amount of days that you are sick with the flu. So if we can catch it early enough, we might start that, but otherwise most patients can bounce back okay after a week or so of the flu. However, immunocompromised patients, very young, old patients that don't have the immune system that we should, if you're on immunosuppressant drugs with autoimmune disease, you might be a little bit more susceptible to some of the complications of the flu, which can be a lot more severe than of a cold. Secondary infections of the cold can be sinus infections, ear infections, whereas the flu, you might have a pneumonia, which can be very life-threatening. Also, your risk of heart attack goes up within a few weeks after having the flu. So definitely get your vaccinations and be aware of these differences so we know, what's serious and what's not. Thank you.